When we use the term refractory or medically intractable epilepsy, it means that seizures that haven't really responded to medications. So previously it would be a child would have, or a person would have refractory epilepsy if they'd been on every single medication known to mankind that could be effective for treating seizures. Now the epilepsy community would really like to urge people to consider using the concept, or at least thinking of the possibility of refractory epilepsy if an individual with seizures has been on 2 medications that are appropriate for that type of seizure, but have not been effective. And the reason the epilepsy community thinks that we should consider thinking about refractory epilepsy earlier is we know that for many children and many adults with epilepsy, medications won't work. And if the medications aren't working, we really owe it to that person to think of other treatment options, including dietary therapy or possibly epilepsy surgery. We have used it in some children as a first-line therapy. Typically, those are families who either have had bad experiences with medications, either for that child or other people in the family, or families that are just very anti-medication. And many people view the diet as more natural since it's just modifying what you eat. We often recommend that families don't use it first line because when a child's diagnosed with epilepsy, they're suddenly different than their friends. And then if you also greatly restrict what they're eating, if they can't eat their own birthday cake or eat pizza or eat French fries at school, it can make the child feel even more different. And so for a child who just develops seizures, oftentimes taking medication once or time a day is easier for the child. But certainly if the medications don't work, or if the medications have any untoward side effect for that child, then we are pretty quick to recommend the consideration of dietary therapy. I think if we look back on the kids that we have put on the diet over the past 18 years that Heidi and I have worked together, many of them have done extremely well. Many of them have been able to come off diet, remain seizure-free. Many of them are in college now pursuing jobs. Many of them also had learning difficulties in addition to the epilepsy, but many of them are also in programs and living situations that are very gratifying for them, and they're very happy. We also do have kids that we were never able to completely stop the seizures with the diet. Many of those kids remain on the diet because even though they weren't seizure-free, both the child and the family perceived the diet as the most effective treatment they had. There have also been some children that have not responded to the diet. Either it's not effective, or oftentimes the child or the family has difficulty tolerating the restrictiveness, particularly long-term, of the diet.